Okay, right. So I've clicked recorded and I'll just start off by introducing myself and who people are going to speak today. So, good afternoon, everybody. I'm Lisa Govey. I'm the Communications and Engagement Manager for Social Responsibility. So, welcome to this Better Health session. It is part of our series of social responsibility and civic engagement sessions, which we've been running. So today you'll hear from Julian Skyrme, Director of Social Responsibility, who will introduce a number of colleagues from our Faculty of Health, Biology, Medicine and Health, who are covering some amazing work supporting our social responsibility aims. The session should last for about 45 minutes, and there'll be time at the end for questions and feedback. This is the final session in our series, which we've been running over 2 academic years. There's one more public engagement session in May, and then I'm sure we'll be repeating some of these sessions with new content and new stories to share with you over the 25-26 academic year. Finally, can I just say at the end of this, I'm going to put a very quick poll on for participants to complete. It literally should take a minute. So if you don't mind just staying at the end just to complete that poll for us, that would be really helpful. I will also share the slides after the session is finished. And throughout the session, I'll be putting a few links and information in the chat for you to link through to for further information. And just to let you know, this session is being recorded. Okay, Julian, you happy for me to hand over to you?
Thanks very much, Lisa, and good afternoon, everyone. Thanks so much for coming along today. We're really pleased to see you, and I'll do some introductions in a moment. But let me, first of all, share my slides. Okay. Is that okay, everyone? Slides sharing? Yeah. Thank you. Okay, so yeah, I'm Julian Skyrme. I'm the Executive Director for Social Responsibility. I'll be chairing today's session, and we have a range of colleagues with us today who will just put their hands up and say hello now. And they'll introduce themselves when they come to their section. So we have Rachel Lindley, who you'll see. So give everyone a wave, Rachel. Rachel will introduce herself when she comes to her section on service learning. We've got a section on patient and public involvement and engagement, and Horace Williams and Natalie Gardner, if you can both wave to colleagues there, they'll introduce themselves in a moment. Thanks, Harris and Natalie. They'll be talking about patient and public involvement and engagement. And then we have Keith Brennan, who's going to be talking about global health. Thanks for the wave, Keith. So colleagues, and also there are some other speakers as well who'll be brought in to bring to life some of these examples. So that's the agenda for today. I just wanted to set this in a quick bit of context of the university strategy. You'll be aware that the university has 3 core goals, one of which is social responsibility. And this isn't a separate goal to other things we do in the university. Most people contributing to this agenda are either involved in research or teaching or both of those things, or in professional services. And I think today's examples are really good ones in terms of looking at the cross-cutting nature of the social responsibility agenda. Within our social responsibility and civic engagement strategy, there are 5 key priorities. Today, we're looking at better health, but there are also priorities for inclusion, for the environment, for prosperity, and for culture. So that today is just one of 5 key themes within the strategy. The spatial dimension to our strategy is huge. It starts obviously on our campus, the impact of our work with our staff and our students and how we operate along the Oxford Road corridor. We're also part of the City of Manchester, which exists in Greater Manchester, within the Northwest, the nation and the wider world, and you'll get all of those spatial dimensions. I suppose we do go into outer space as well, I should say, in terms of our radio telescope at Jodrell Bank. So in terms of our spatial impact as a university, it's huge, and you'll really see that today, the local and the global. In terms of our performance, we have a target to be in the top 2% of universities globally for impact towards the UN Sustainable Development Goals, and we also have a target to be in the top decile in the UK RI Knowledge Exchange Framework for Public and Community Engagement. So in terms of how are we doing, well, we are in the 0 top 0.09% of universities in the world. We're second in the whole world at the moment for our impact towards the UN Sustainable Development Goals. So that's top in the UK, top in Europe, and second in the world. And we're the only university actually in the world that's been in the top 10 for performance on the SDGs since this ranking's inception in 2019. In terms of public and community engagement, we rank in the top quintile for that performance. That's the highest performance you can get for public and community engagement. So just to say a little bit about what we're going to look at today, this is a focus on better health. All faculties contribute to work on better health, but the main faculty where people come from today in today's session is from, as you might expect, the Faculty of Biology, Medicine and Health. And under better health, there are three key priorities, which we're going to talk about each of these today. How we're addressing global health challenges. You hear from Keith in our third example today on civic health challenges, looking at how we're addressing these particularly through service learning programs. You'll hear about that in a moment. And secondly, you'll hear from Howis and Natalie on patient and public involvement and engagement in research. Just to set some of this in both a local and a global context, though, any of you interested in health will realise that health outcomes vary enormously by background. In Greater Manchester, we have some significant challenges. Life expectancy, for example, is a couple of years lower on average across Greater Manchester than it is across England as a whole. But this masks significant variations in life chances. So, for example, if you're a male and you live in the Wythenshawe part of Manchester, your life expectancy is around 71 years of age. Whereas if you take that to a female who lives in Didsbury, you might expect them to live to around 82 or 83. So there's about 11 or 12 years difference in life expectancy for people who live just a few miles apart in our city in Manchester. We also know that around a third of residents in Greater Manchester live in the poorest 20% of households. We know there's around 250,000 people out of work. The biggest reason why people are out of work is for health reasons. So there are significant challenges around health outcomes in a city region like Greater Manchester. When we look to UN level, and Keith will talk about global health later, there are some significant improvements we see around the world, but also some ongoing challenges. So there's been big improvements in the world in terms of under 5 mortality rates, on reduction of deaths from AIDS and reductions of tropical diseases. But also we know there are a whole range of people who are pushed into poverty because of the costs of health around the world. There's a huge number of people who are pushed into extreme poverty because of health conditions. We know there's challenges around malaria. And we know, for example, that in terms of female mortality, women die from preventable causes related to pregnancy and childbirth every 2 minutes. So in the time we're on this session today, which is around 50 minutes, 25 women will die in the time we're in this session around the world from preventable causes relating to pregnancy and childbirth. So it gives you an idea of some of the global health challenges there are. So significant challenges, and what you're going to hear about today is examples of where the university is trying to address some of these things. So I'm going to hand over now to the Vice Dean for Social Responsibility in the Faculty of Biology, Medicine and Health, to Natalie Gardiner. And Natalie's going to say a little bit about the faculty approach before we open up the 3 case studies. So Natalie, please, over to you.
Yeah, thanks very much, Julian, and good afternoon, everybody. So yes, in the Faculty of Biology, Medicine and Health, there's a huge amount of work, as you'd expect, from discovery science to outreach, to engagement, to research, to teaching, to really sort of try and promote better health. We work in BMH around these 5 key priorities. So service learning, which Rachel and colleagues will speak to later, work in the Global South, which Keith Brennan will speak to later, environmental sustainability, EDI and civic engagement involvement. And we'll talk a little bit more about the work that we do with our public and patient partners and contributors to drive civic and global, local, national engagement in everything that we do. And I've just shown a snapshot of some of the few different pictures of the variety of ways that we do this, through sort of public outreach, through work in schools, through local communities, and hopefully you'll get a flavour of lots of the great work that's going on in the presentations to follow. So on that note, I think I'm going to pass forward to Rachel.
Hi. Next slide, please, Julian.
Okay. There you go, Rachel.
Great. Hi, I'm Rachel Lindley. I'm the co-lead for Service Community Engaged Learning in the faculty with Professor Raj Arianatnam, who's in dentistry. Essentially, for those of you that don't know, service learning, it's for us in FBMH, we're calling it a positive symbiotic engagement exercise in the community where students and the communities are expected to benefit equally. And it really is about that symbiosis. It's not just about us doing. There are lots of benefits which you can see there, but I think the main thing in my session is I want you to hear from Rachel and Christian. So next slide, please, Julian. Thank you. So we've done a lot in the last sort of few years. We've got a website, you can have a look at that. We've got the conference, and you'll keep an eye out for those coming up. We had Professor Lynn Bianchi doing our keynote, looking at schools, particularly because that's a great area of need, and also where we can make a lovely partnership arrangements. And what we're doing is building on a lot of those at the moment. And we're strengthening a lot of links between our community partners. What I really wanted to say here for everybody is if you are interested, please join our service learning practitioner chat. It's very open, everyone's welcome. And we've also got a student group of student code deliverers for training sessions in partnership for making work. So please get in touch, anybody. We're very welcome to have you. Please, next slide, Julian. Thanks. So these are the things that we're going to be doing more. We're going to be building on one of the projects that Christian's going to talk about now, and build on our schools projects, coordinate our numerous health check activities, which are in pharmacy, optometry and medicine in dentistry, so that we're trying to all work together to have even greater impact. And we're trying to give more support to our students to be co-partners, co-deliverers in all this activity. We've got the hub, which is building, and hopefully there'll be a travel app which will be launching in the next year if we can get everything lined up to make it easier for students and staff to get out and about to these places. Next slide, please, Julian. So what I want to talk about first, we've got Christian Dodworth, who's very kindly stepped in, and he's going to sort of give a bit more information about the neighbourhood study. What it is, this sits in nursing. It's an example of a really lovely service learning project. It's on the B Nurse, and it's in the first semester, and the students go out to local parts of Manchester, Stockport and Trafford for five days over 5 weeks. There's 260 students involved. They go out in groups and they look at their communities, the neighbourhoods, what's going on there. So it's really coming out of the partnership for the students. What they need to do is they need to understand their populations, but the council always also had a need, which I wanted to bring Christian in to talk about, if that's all right, to outline what that need was and the impact for them. Thanks, Christian.
Thank you. Thanks everyone for inviting me. Yeah, so this is really important for us. It's, you know, the program is a really exciting program from our point of view. So Help and Support Manchester is a directory of services. It's a statutory duty through the Children's Act and the Care Act. And we have to keep that directory up to date. So what this gives us is that opportunity for them students to go out and first of all, do a bit of an audit of what's already out there, but also for them to help us to find new services to go on there. It's only a very small team. There's only 3 in the team. So obviously, and we're kind of centrally located. So it's really difficult for us to keep that information as up to date as possible. And that is the key to all of this. We need to make sure that information for the public, and it is a public facing directory. So potentially it could be the whole population of just over 550,000 people in Manchester. Not only that, it will be for practitioners. We really want this directory to be the go-to place. So this programme has really helped our directory, and those students have really upped the game in the sense of going out and finding those community services and supporting us to keep that directory up to date as possible. Thank you.
Thanks, Christian. Yeah, exactly. And it's just literally 5 days. That's it in the programme, and we can roll it year on year. And this is kept reliable for the whole year for all the population. Okay, stop.
Can I have
Stop.
I have the ice
Sorry,
cream?
and then I just need to pass out. Sorry, my son has been ill this week. I need to pass over to Rachel, who's one of our students, who's wasn't involved in the neighbourhood study.
Hi.
Right, yes, you can have it. Yes, you can have it. You can have an ice cream, anything. He knows the moments. So yeah, pass over to Rachel, who's one of our final year dental students, who's not been involved in the neighbourhood study, but has been involved in other projects. Thank you, Rachel. I'm going to video off.
No worries. Hi everyone, as Rachel said, my name is Rachel Lee. I'm a 5th year dental student. I do just want to emphasise that service learning has been an excellent modality for me in terms of my learning and education here at the university. I have been involved in a plethora of service learning projects. I think most notably is the Dentist in Primary Schools project. This is a project that we started 4 years ago where we delivered oral hygiene educational workshops in local primary schools in Manchester. For those who don't know, about 1 in 3 children in the Northwest experience tooth decay, which is a preventable disease. And it is a project where both dental students and primary school students collaborate, where the dental students can teach the key oral hygiene messages to the primary school students. So far, over the 4-year period, we've reached over 1,000 children, which has been amazing. And due to the success of that, we actually applied the project internationally this summer, where we went to Kenya and we recruited local volunteers there, trained them in the dental and session knowledge to deliver the sessions. And through that, we were able to reach nearly 900 children and speak to about 500 senior class students. From that, we were then able to establish a toothbrushing initiative where we collaborated with Colgate with projections of reaching 7,000 students in order to make sure that they have accessible armamentarium to maintain good oral hygiene habits, which we recognise as a barrier over there. And we also recognise that we developed the project to be self-sufficient, so it doesn't rely on us at the university, it relies on the primary schools, Colgate, and it's in a way that it's beneficial to them where they can monitor it themselves. And overall, this has just been entirely student-led, consultant supervised, and we've really enjoyed being able to apply our theoretical knowledge to benefit a plethora of communities, both locally and internationally.
Thanks very much, Rachel. That's an excellent example to bring to life from a student perspective, the benefits, and from communities as well. And when Rachel talked about service learning, meaning that both communities and our students benefit equally, I think it's just a wonderful example there. This is going to make us a better educator of future dentists, but also communities benefiting at the same time rather than waiting until our students graduate. So thank you for sharing that. I'm going to pass over now to Natalie, again, who's going to talk about patient and public involvement and engagement. So Natalie, please. Thank you.
Yeah, thanks, Julian.
Study now. Thanks a lot.
Yeah, thanks everybody. So yeah, involving patients and the public in the work is so crucial to us in FBMH because so much of what we do really affects the health and well-being and lives of so many millions of people, both in our local communities here in Greater Manchester, also in the Northwest, nationally, and indeed globally, which Keith will come to. So really by involving a whole range of partners in our work and sharing experiences, sharing knowledge, we gather the valuable insights that we need to achieve more effective, more meaningful and inclusive research and teaching and outreach. And one of the ways that we do this is through our sort of PPIE forum. This slide here just shows a few of our numbers. You know, in terms of our faculty, we've got over 500 research studies with over 75,000 participants per year. We've got 500 public contributors who are helping us shape and generate and organise our own research. And our PPIE forum, we've got 49 members. We've got staff, public contributors, students who really come together to help us determine our strategic direction, our governance. They've co-developed our action plan. We've got PPIE standards, public contributor induction guides, which has now been accessed over 1,000 times. So it's really well thought of and utilised. And we've got a public contributor toolkit that's been accessed over 9,000 times, which is just phenomenal. Our last annual audit of engagement activities, we found over 100,000 engagements with the communities, with different communities. And it's a real active partnership between members of our faculty, our staff, our student, our public contributors. They're helping driving our research and our teaching and our outreach. And I'm going to pass over to Hawis now on the next slide, and she's going to take one of these sort of very, very current examples forward as to how our public contributors and our scientists are working together. And I'll hand over to you, Hawis, and stop talking now. Thank you.
Thank you, Natalie. So I'm presenting on behalf of Dr. Suze Johnson and Dr. Binish Khatun, and it's all about the tree of life. So research shows that the uptake, participation and experience of UK ethnic minorities in relation to breast health activities remains a very serious concern. Minoritised women are at a greater risk of being diagnosed with more aggressive breast cancer at a later stage than white women. This may be due to lack of knowledge, access and cultural factors. Working towards the equity in Greater Manchester requires an approach that directly involves community groups for a better understanding of deep-rooted cultural beliefs and attitudes. To this end, Susan Binish worked with women from Pakistani, Bangladeshi and Indian heritage to better understand their life journeys and health experiences so we can support culturally appropriate interventions for breast cancer. This was done by using a creative arts and narrative therapy approach within culturally distinct focus groups. It was led by researchers who shared heritage with the participants and were skilled at creating those incredibly important safe spaces with no judgment. It enabled a deeper understanding, an open dialogue and sustained trust building. And people were united by their shared experiences that they could reflect together. So this is currently showing within the South Asian Gallery in Manchester Museum. So I would really, really urge and encourage as many people as possible to go and look at this. It really, really is incredible, with people telling their own stories and their narrative as well. And this quote is that all around the incredible stories about origin, adaptation, family and health, and work together with the museum and a creative team to bring these stories to life. It's all about the participants' bravery and openness, that only doing that can help capture new audiences and hopefully inspire others. So thank you very much. Thank you.
Thank you very much, Hawis. That's a great example. So that's our second example of patient and public involvement and engagement. We have a third case study, our third and final one, which is from Professor Keith Brennan. Keith is our Vice Dean for Internationalisation in the Faculty of Biology, Medicine and Health, and we'll be talking about global health. So Keith, over to you.
So thank you ever so much, Julian. It's an absolute pleasure to be able to come and talk about some of our global health work today. Sorry, excuse me. Where I was going to start actually is talking about or thinking about our Africa strategy. This is a strategy that's been written in the university and looking at how the university will work with African institutions, whether that's a university, an NGO, the government, etc., and actually thinking about how we should do that. So it's very much focused around equitable and durable long-term partnerships, very much listening to our partners and wanting to understand what their questions are, and actually starting to address questions that are really shared between African nations and ourselves, really coming up with answers that will improve health for all humanity. Now, or I should improve, I shouldn't say health for all humanity, that's me being biased, but we're from the biology, medicine and health. So it should be, it's all questions. So whether that's something like climate change, whether that's health, whether that's sustainability, waste management, a whole host of things. I'll let Julian run this video now, and then I will come back and add a few extra things where the focus is within our faculty. Okay.
Not at the moment. I can try and open it in YouTube instead. Just a moment. Bear with me. So I'm going to stop share, reshare a different window. Nothing like a bit of pressure, is there? This moment.
Thank you, Julian. You're doing great.
Google
It did
Chrome.
run earlier, just fine.
It did work absolutely fine. So this is my Chrome. I'm going to make that bigger. Just a moment. Is that okay, everyone?
Yeah, grand.
Global challenges demand global solutions. Our researchers are collaborating with colleagues across Africa to accelerate change and drive our understanding.
Together, we are improving awareness of disease prevention and vaccination, shaping infection care and management, expanding access to treatments, and developing the next generation of healthcare workers.
From uncovering the origins of cancers to preventing stillbirths and understanding heart disease, our partnerships are tackling some of the continent's biggest health challenges.
We're working in Africa to help find answers to some of the world's biggest questions.
The discoveries made today will benefit communities tomorrow.
We have got a long way to go, but we are committed to working together on the journey.
Thank you, Julian. So whilst you find the slides again, so from the point of view of the Faculty of Biology, Medicine and Health, there is a particular focus to these questions. One relates to non-communicable diseases. It's very clear from the statements of the WHO that non-communicable diseases are becoming increasingly common, particularly in global South countries. In Kenya, deaths from non-communicable diseases will exceed those from infectious diseases, and maternal and newborn deaths. And Julian told us how often you get maternal deaths. Non-communicables will exceed, as I say, infectious and mother and newborn. The other sort of aspect that is very much an equity question, so it's having non-communicable diseases are certainly having much greater effect in global South countries, but it doesn't matter which society you're in, the poorest in the societies will definitely be the most affected. The other sort of aspect that the faculty is very much interested in, and it relates to what we do here in the UK, is how do you generate workforce? Again, the WHO predicts that we will be between 10 and 14.5 million health workers short by 2030. 6.1 million of that deficit will be in Africa. Another 4.7 million will be in Southeast Asia. And the WHO definitions of that Southeast Asia region also includes India, but you are talking about that whole sweep from India down through Malaysia into Indonesia. So it's a huge deficit that you're seeing in both those areas. And another question that the faculty is very much interested in is how to build those numbers and build those numbers globally, and how do you do it within the local markets? So very much the African strategy was launched. I've seen that Lisa has dropped into the chat a link. On the slide is actually also a link to the document itself, so that you can go and read it there. But we actually had 2 weeks ago the opportunity to launch this strategy in Kenya itself, and a chance to see many of the fantastic pieces of work that are going on there. And I would emphasize this is very much work of all of the university. When you come to look at it, there are projects, although coming through a health lens, they come out of all three faculties. And the booklet that's shown on the left in the slide actually is a little summary of just the projects that sit in Kenya. I know it's not complete, but there's at least 17 in there, and there's many more to add to it. Whilst getting a chance to see some and to give you a feel for breadth, we had the pleasure of going to see a breast cancer project out in Kisii County, where very much the same Tree of Life method has been used to develop local support groups for breast cancer in that county in Western Kenya. It was absolutely phenomenal to see. And actually, one of the researcher that led that is also one of the researchers that led the project. It was involved in the project that Howes has just mentioned. We've seen work being done to look at emergency medicine and how do you actually develop an ambulance service or strengthen an ambulance service in different counties. We have a massive project in and around esophageal cancer, which is a very different disease in Kenya than what you see here. And we will not be able to address treatment of that disease without working with our Kenyan colleagues. We've seen projects in water. It's still frightening to think that in some of the towns that are growing fast in Kenya, they are having problems with cholera. There is not the waste management for sewerage to separate it from water supplies. The towns are just growing far too fast compared to their services. We've also seen projects around waste management. There's a lovely picture there of the local dump that they took us to in Kitengela. I can rest assured the smell was extraordinary, and the marabou stalks were slightly disturbing, sat on top of the refuge heaps. But we've also seen wonderful projects that look at recycling within informal settlements as well. We did see some great urban agriculture where the food miles is about, it can be measured in feet rather than miles, and how that's actually supporting development within the community and also better food, better nutrition. At the bottom, you can see Nalin in one of the local schools. We actually had, again, opportunities to look at the informal settlements where they're talking about essentially free school meals and how do you actually ensure children have nutrition during the day in part because they wouldn't eat otherwise, and also to obviously support their education. The last bit I'll pick up is on shared landscapes. This is a beautiful piece of work out of FSE, looking at how humans, cattle, and wildlife all interact, and how you actually see potentially can see diseases passing between all different populations, and how do you actually ensure that these sorts of things don't happen, and that you actually have the wildlife, which is essential for tourism and income in Kenya, the cattle, which are essential for nutrition, and a healthy human population too. It was an extraordinary week. It's an extraordinary to see just what the university is doing, and this is simply in one country in Africa. This is replicated across the continent with some real beautiful projects which are impacting, as Julian mentioned at the beginning, around SDG 3, good health and well-being.
Thanks.
I should finish very, very briefly, if I can, Julian, mentioning Rachel Lee's visit out to Kenya. We also have visits by some of our medical students, but actually, due to the generosity of a donor, we have the possibility of bringing Kenyan students to us, and meeting them on campus last year and hearing their stories was just, it's one of those moments that you treasure. And I'll finish there.
Thanks very much, Keith. I'll just unshare the slides for a moment. Thanks for all of our speakers there. And it just a real reflection listening to the impact. We talked earlier about doing things in our most hyper-local communities around our campus in places like Ardwick and Hume, and also to talk about the work we're doing in Kenya. And it really strikes me that universities are really good at this. You know, as a sector, we do need to talk ourselves up about this. We can do both of those things. It's not necessarily one or the other. And I think we're some of the few institutions that have that reach. A lot of companies don't, for example. They will operate just in Western or global North markets, for example. So I think it's quite an interesting reflection on the impact of a university like ours, that's both a civic university and a global institution. I think that's come through so well in the presentations. So what we always do now, we open it up, and if you want to put your hand up and unmute yourself, you're welcome to ask any questions of any of the panelists or contribute a point which you feel you would like to make from anything you've listened to. So I'll just open it up for a moment, and if nobody can think of any questions, I've certainly got a few and I'll put them to the panel. But we'd really like colleagues who have given up some time today to come along and listen to just, if it's an observation or a question. So I'll leave it open to you first of all, please. I'm sure you're not too shy. So if you've got an observation or a question, please feel free to put your hand up. I'll get it going then with one, because it's just listening to Keith's presentation really made me think about the relationship of the university to what's going on in global politics at the moment. You know, America first, Europe first, Britain first. What would you say, Keith, to people who might say, well, the University of Manchester needs to concentrate actually on all the problems in Greater Manchester? There's many in Greater Manchester and in Manchester. Why should we be, a university like ours, be going to an African the African continent and going to countries like Kenya? Why should we be doing this? How would you defend that as a from the point of view of the university sector and the University of Manchester in particular?
So actually, I think there is this is one of the things that we pick up in equitable partnerships. There is as much we can learn from our partners as they can learn from us. And actually, you know, the esophageal cancer grant is an example of that. That type of cancer that they see in Kenya is completely different to the one we see here. Without working with our partners, we would learn nothing about that disease. It just wouldn't happen. So that is one very direct example. I've seen also work that's being done in Indonesia, looking at cognitive behavior therapies using telephones to support people with low-level anxiety or depression. They're currently back translating that work into the NHS here. So it's something we've learned there, but we are actually influencing our system here. The other thing that actually I was going to pick up with, and you were sort of touching on it with your question, number of times that I've turned up somewhere and it's our convening power, our ability to bring different people into the room, whether that's a government, whether that's a hospital, whether that's a company, other universities, ourselves, and you can ask that awkward question, and you can affect a change in what's happening elsewhere. I have absolutely no idea how we ever record these things or score these things or report on these things, but the effect that you can have and change processes is immense. Just because you're the outsider, you can ask that slightly awkward question.
Yeah, and I think this touches on a really big distinction universities have of being non-political organizations, I think. So in the type of world we live in, governments, people who run different countries will change, but the population as a whole, you know, you could take one approach because well, you blooming voted for them, then it's your own fault. We don't take that approach as a university, of course. We're interested in improving humanity. And I think that's something, you know, it's a really, it sounds quite trite to say that, but it's such an important thing to keep restated in the type of world we live in now. And I know that, you know, we've had some challenges working and thinking about, well, what about the Rwandan government's policy on X or Y that we might not like, for example. There are still major health challenges there. And I think universities are these amazing institutions that can work across some of those boundaries and those awkward things that divide us politically, perhaps, in other spheres of life, from government relations, and where universities are just so good at ensuring that those relations and also educating future leaders as well. You know, the University of Manchester and some other, particularly other Russell Group universities in the UK, because of their historic privileges, of course, you know, have educated many of the leaders around the world, many of the ministers around the world. And that convening power you talked about, Keith, I think is really important there. I want to flip the question then to Rachel now, if you don't mind, Rachel, and just say that why would we want to work in Greater Manchester? And the converse question, there's so many, if you think about health inequalities in the global south, they're far bigger, you could argue, than anything we experience in the global north, in a modern, well-resourced country like the UK, in a city region like Greater Manchester that's thriving. Why should we be focused on health inequalities locally when you've just listened to what Keith is talking about in Kenya, which just seems so many miles apart? Why would we do that as a university?
Yeah, I mean, I get it. I get it that in contrast, you think, oh, this is feels relatively minor. But I suppose my experience over, the 30 odd years I've been in this sector is that there's so much to learn. You have to understand who you are. You have to understand how to work in partnership and genuine co-production with people. How do you understand what their need is? And I think the first place you have to do that is on your own doorstep. Understand who you are, understand who your population is, and get those skills and that sort of humility, really, to say that I don't know. The only people that know are you. And in my experience, it's just much easier, and people get that joy of going, oh right, I've got to retreat and learn something new. Let's try again. Let's keep going, and then you see the win. You get to see the win up close. That's for me one of the things. The other things, I think we are in a global ecosystem, like what we do here affects so many other places. You can look at models, you can share models like what Rachel Lee, our student, did, is you go, right, let's work this up here locally. How does this model work? And then you do it in discussion, and then it keeps growing in other places. So yeah, I think start small and local, and then build it global.
Yeah. Thank you. I mean, the offer's open for anyone to put their hand up, by the way. I'm still hoping somebody might want to ask a question. While we're doing that, Rachel, I just think, your experience, what you talked about earlier, I think cuts across, you've done work locally and globally. So just from the point of view of dentistry, what are the comparisons and contrasts between some of the health challenges from the perspective of a future dentist?
So what I thought was really interesting with your two previous questions about the differences of demands is that in terms of dental decay, the demands are actually quite similar. It's usually about 1 in 4, 1 in 3 in both Kenya and Manchester experience tooth decay. What we did find though was that we actually did a observational placement at a local dental hospital, and the resources there were, let's say, in demand. We would ask them how many patients they had, and their response was how long the equipment lasts. So we found like a lot of barriers were to do with access to dental care, access to armamentarium, and access to information, really, as well as the economic implications of it. Here in the UK, we would say that it's less about access in terms of accessing toothbrushes and toothpaste, but more about accessing dental care and the education as well. Sorry, I've got a bit of a cold as well.
That's a great example there, Rachel, about the comparisons. And it's exactly the point Keith and Rachel are making, that we can't make these simple distinctions between the local and the global and how many of the challenges interrelate. And then just still it's open to anyone who wants to put their hand up. I'm still keenly
Julia,
looking.
can I add on to Rachel just briefly, just as something I find quite frightening? There are only 2 dental schools in the entirety of Kenya. They have a population of 55 million, so a bit smaller than us, not much, and they only have 2. And the entire cohort in each of those dental schools is about 20 a year. I think we have 17, something like that, across the country. Cohort in ours is 71, up to maybe 80. It's just the workforce deficit is mind-blowing.
When you actually look at the World Health Organization statistics in Kenya, it is a ratio of 0.2 of one dentist to 20,000 of the population. So it's very, very tiny in terms of the workforce to the population. So that's why we were very much encouraging to target the communities and educate them by themselves if they can't access the actual dental care up there. We were also encouraged by Colgate to work with those universities to try and educate the students as well to go out into local communities rather than just focus on their practice, their clinics, or their hospital base.
Yeah, really good point, Rachel. Thanks for that. And then I was going to ask, this is probably for Howis or Natalie, really, this question. You talked earlier about involving the public and patients, but you could argue we're experts. We should just be getting on with our research and our teaching and trying to transfer that knowledge into society. Why is it so important that we actually involve patients and the public then as a university? What's the point in doing it?
It's about relevance, isn't it? It's about ensuring that our research and teaching are relevant to the communities that we serve.
Are we asking the right questions? Are we doing it in the right way? We can only do that by involving the public, patients, communities in everything that we do.
Thank you. I think that's a really...
To Rachel's symbiosis, we all learn from each other and create the right outputs.
Yeah. And we talk a lot in the university at the moment about listening better and creating, and that doesn't happen by accident. So having the forum that we've got in the faculty, having mechanisms to involve, to pay people for their time, for example, to genuinely listen, to ensure that the public can lead discussions, not just follow and have ownership over things. This isn't tokenism, this is really important because it changes the way we teach. It changes the research questions that we ask as a result of this. So we talk a lot about teaching impact and creating employable, impactful graduates. We talk a lot about ensuring our research makes a real difference to society by involving the public in our work. This is how we create impact right at the beginning. It's hardwired into the very beginning of the process before we even decide what our hypothesis might be or our research questions. And the earlier we can involve the public in our work, and this doesn't just apply to biology, medicine and health, by the way, it applies across all of our work. The earlier we can involve the public in our work, the more relevant the university will be to society. And I think that's why we're all here. That's what we're all committed to, the unifying factor, why you've come to listen to this, why you've participated and given the case studies, is that's the underlying theme, really. We want our work to make a real difference. So involving the public in our work at the very start, not at the end when we're thinking of delivering, communicating some results. We know that doesn't work. The idea of knowledge transfer, if you remember that as a concept, knowledge exchange is slightly better, but I think genuine involvement and engagement is what we all strive for. When we do that, we can do much better quality of work. And it's not to say that our expertise isn't important, of course, but it's that expertise in partnership with real knowledge. So I'm going to give one more opportunity if anybody else has got a question. Otherwise, Lisa's going to put up on the screen. We're going to ask people some questions and I'll start to wrap up. So colleagues can answer some of those questions quickly. It's two really quick questions, so please take time to do that. And what we're going to do now is start to wrap up by saying that, first of all, thank you to all of the speakers who have contributed this today. You've given some really amazing examples from the faculty of local and global impact. Thank you for doing that. We've recorded today's session. We'll make sure this is shared widely across the university because they're such good examples. We also, if you've signed up to this series, you'll be aware that there are a range of other sessions, and Lisa's put a link to those in the chat, and we will also email you a copy of the different sessions that you can sign up to. So I think, Lisa, that's everything by way of wrapping up, I think. Is there anything I haven't said before we...
No, that's everything. The poll's up there. Just in terms of the other sessions, for this academic year, there's only one left, which is the public engagement one, and then we'll be starting a new series from September.
Thanks very much, Lisa. So that just leaves me to say thank you very much for everyone that's given up their time today. We really appreciate it, and I hope to see you around on campus or online again soon. Thank you very much to our panelists, and thank you to everyone who's attended today.
Thank you, everybody. Thank you.
Will you stop recording, Lisa?